Good morning, everybody, and welcome to Health Talk. I am your host, Dr. Niru Prasad, with my background in pediatrics, emergency medicine, and urgent care. Today, my health talk, I'm going to talk about the immunization, about immunization for our children, adolescent, adults, and also senior citizens. The what I have done is I have prepared some graph about the what are the routine immunizations that are recommended by the CDC about children's, adolescent, and adult and senior citizen. These routine immunizations, they go for everybody. And what I'm doing today, I will focus my attention basically about the three major viruses that are pandemic now during late summer, fall, and winter. And they include COVID-19, RSV, HPV, and HPV, human papilloma virus. So just to share some updated information with our viewers, as of 2025, several important updates have been made in the field of medicine, and that includes the RSV vaccine for infant, a continuous research and development of COVID-19 and meningococcal vaccine for our adolescent, and those updates on that. So why does immunization matter? Vaccines, what do our vaccines do? The vaccines prevent a serious illness, hospitalization, and outbreak of the individual. And this is crucial, especially during fall and winter and back to school season, since children are going back to school, they have a good exposure to the other kids with their similar background situation, and we want all those people, all those kids to be properly immunized according to the American Academy of Pediatrics and CDC. There, I have gathered some information from my reading all this about the immunization that the rural areas in United States as well, the third world country, they have a very low, they have a low reporting diseases surge. So they are the one, if they are not properly immunized, they spread the disease to the other children when they go back to school. So COVID-19, first I will touch the COVID-19 vaccine, the update. The 2024 to 2025 vaccine that we have come up in, that I think the vaccine just started early part of 2025. It targets the JN of Omicron variant. As we know, I will show you the picture of the COVID virus and the Omicron virus. Now, we have put down there of Omicron, but they keep on mutating, and they have different mutant variant, and that are very infective. So offers improved this vaccine that has come up in the market basically by the Moderna next spike. This is a RNA vaccine which is fully FDA approved, and these vaccines are recommended for the eligible individuals even before the winter starts. So here is a picture of the three different kind, which are all cousins. The first one, as we know, is the COVID-19, a very common photo that you said all over the COVID era, COVID-19 with their spikes. The next one is RSV virus, and the third one is the flu virus. So these are three different kind of viruses anatomy that we are dealing with during our preventive measures with the immunization. So what happens, now the RSV vaccine? This is RSV vaccine. This is respiratory syncytial virus vaccine, and this is very highly recommended for adult and seniors. So the CDC recommends a single RSV vaccine dose that is for the adults, children over 5 years of age, not below that. And also it is recommended for the seniors, especially in the nursing homes, because they are immunocompromised and they are very susceptible to get the lungs infection like bronchitis, pneumonia, and all this. What it does, the single dose of RSV vaccine, which is very stable, it it prevents the severe respiratory complications. It is strongly advised before the flu season and the cold season. The flu seasons mean during the fall and the early winter. Now this RSV vaccine, like I said, 5 years and below, but there is a new brand of RSV vaccines which have been approved for infant. What it does, it protects the early life respiratory infection, and it is administered through pediatrician during routine visit, and also in the when the kids are born to the susceptible individual, to the susceptible mother family. These are crucial. This is RSV vaccine is crucial for infant with the underlying health risk, such as prematurity, born to immunocompromised mother. And so what it does, before we used to see a lot of cases of respiratory syndrome when the kids are born, but if they are immunized but these babies, if you are immunized, they have less symptoms or no symptoms maybe at all. So what is the safety for this RSV vaccine? I went through a lot of studies that have been done in the research lab, and also whatever are the side effects in details. I'm unable to produce all the data, but in the bibliography, I have mentioned the details about the safety information and the nature of RSV vaccine and how it is prepared. One of the rare risks for this vaccine is a condition called Guillain-Barré syndrome that has been reported in some adults, and that happens usually within 40 days of the vaccination. The normal common side effects of any vaccine, whether it is COVID, whether it is RSV, whether it is flu, includes arm pain, swelling, fatigue, mild fever, muscle ache, and however, all these symptoms, ignoring all these symptoms about the vaccine, the benefits outweigh the risk in most cases. So now coming back to the flu vaccine, which is now end of the summer and the fall is indicated for our population. The new formula has been approved of this new flu vaccine, it is a new trivalent flu vaccine. It is a tree, like I said before, it is a trivalent flu vaccine, and this protects against three strains of the flu that have emerging. This is recommended for all age annually. This trivalent flu vaccine is very much important for young children, senior centers, and people with a chronic conditions as well who are immunocompromised. So now I have been continuously in touch reading about what are the outburst diseases that have come up, and one of the disease that has a surge is the measles and the meningococcal surge. Now, measles outbreak is rising in under-vaccinated areas. Before, I thought we eradicated the measles because of the proper immunization. However, in underdeveloped countries, children in the rural areas, not much facilities available. There is a measles outbreak. It is rising in under-vaccinated areas. There is a what are the causes? Why measles is coming up? Like initially, there's a proper immunization that is recommended by CDC, American Academy of Pediatrics, and there is a drop in kindergarten immunization, and this is a key factor for the measles virus to surge. But similarly, meningococcal vaccine, this vaccine is strongly recommended, especially for the teens, for the college students, and also the travelers who go to the other countries. Early vaccination can prevent a life-threatening illnesses in any individual. So, a few words about the human papilloma virus. This vaccine has been recommended by the state of Michigan for all the adolescent, the college students, senior high school students, because what this vaccine does, it protects against cervical cancer and genital warts in both men and female. Now, besides this, I went through the write-up, and I found out that other recommended adolescent vaccines include meningococcal vaccine, like I mentioned before, hepatitis A and B, and of course, tetanus, diphtheria, and pertussis vaccine. So now I mentioned about the tetanus, diphtheria vaccines because people who are visiting the third world countries where there are not many facilities available, if they hurt themselves, they injured, they have a skin infection, any break in the skin, there are more chances of getting tetanus. So those are the individuals, when before they plan their trips, they should be going to the immunization center and center, even at the boundary, and get all the necessary vaccines. Now, this one, what are the vaccine preventable diseases? There are many. However, the 12 major vaccine preventable disease include measles. Second one is mumps, which is very rare, but still once in a while you see them in a patient with a swelling in the face, in the parotid area due to mumps. Rubella, German measles. German measles is very prevalent, and as we all know, in details, the German measles in a mother can cause deformity in the babies. Polio vaccines is prevents the disease, the vaccine against polio. Diphtheria, we don't see that many cases of diphtheria in United States. However, it has been reported, recent NBC News, they have reported cases of diphtheria from people traveling from Mexico, from the third world countries. Whooping cough. Whooping cough at one time was almost eradicated in pertussis, but now the vaccine prevents, if you have enough vaccination, diphtheria, tetanus, polio, whooping cough, then these things are prevented. Hepatitis A and B. As we all know, the hepatitis B is a blood-borne disease, hepatitis virus. Hepatitis A mostly from the food. From the virus is transmitted from eating certain food. But now we have an available vaccine for hepatitis A, hepatitis B. Now, Haemophilus influenza, HIV. This vaccine is very, very important because, right, I remember during my residency program, we used to see a lot of babies with a meningitis due to the HB influenza. Now, due to this proper immunization, we don't see that many cases of meningitis anymore. Pneumococcal disease, very important to get the vaccine for pneumococcal disease because the vaccine, it prevents against getting bronchitis and pneumonia. And important to get the pneumococcal vaccine. Rotavirus, very interesting. They have been reported a lot of in the past, people going to the cruise, and during the cruise there is a viral surge of rotavirus. They become sick, the affected individual becomes sick with the diarrhea, vomiting, muscle aches. So those are the symptoms of rotavirus infection, especially during the crowded atmosphere. Meningococcal disease, like I mentioned before, meningococcal disease can be easily prevented by this 12 major vaccine preventable disease. By etiquette vaccination, these complications can be easily protected against So now vaccines. Now the fall and winter. What is the current CDC recommendation? The current CDC recommendation for most individuals are COVID-19, RSV, influenza, pneumococcal, especially for the high-risk groups, and the meningococcal vaccine. Adolescent and young adults who live in the dorm, who lives in the boarding house at the college or campus. These are very important. Now, what is the difference between immunization versus vaccine? Vaccination means receive a vaccine dose. Immunization means develop immunity after the vaccination. There's a different. So these two are different entity. Immunization that you develop after the vaccination, and vaccination when you receive the vaccine dose. Not all vaccines provide instant immunity, so a follow up is always advised. So, what are the health beyond vaccine? It's just important this chapter because basically what it is, no matter how properly you are immunized, you have received the vaccines, still there is healthy living. So, just a healthy living supports a strong immunity in the body. So, what is a healthy living? That involves a balanced diet. Regular exercises are very important for our body, mind and body. Quality of sleep. Sleep is very important figure of anybody's life. Person should have enough sleep. Stress management. I don't know how much I can talk about the stress management. It is an entirely different chapters. Positive mindset and relationship. Very, very important. Very important. Have a positive thinking in your mind and a relationship. So, a summary and the takeaway messages before I end my talk includes stay current with the vaccines, especially COVID-19, RSV, flu, and HPV. Everybody should have a regular checkup with a pediatrician or primary care physician or whichever doctor you are assigned with. Encourage a community-wide vaccination because just because one person is vaccinated, it doesn't help because they go back to the community, they go back to the crowd, and then they get more exposure, more exposure from the other. Protect yourself, your family, and the vulnerable population. So these are the takeaway messages. So the resources that I have mentioned when I went through preparing my talk includes CDC, World Health Organization, ACIP, American Academy of Pediatrics, and the National Health Institution. I just want you guys to know that these are my personal views from my extensive clinical practice working at a busy emergency room, urgent care, or office practice. I have some chart of what are the routine vaccination according to age that I will insert you. And this is all in my book. I have written this book. And my book, this is a guide to navigating childhood development. And my book has got the good chapter on the immunization as well as healthy food. And basically I like to thank our speakers, our viewers the camera people, for joining, for helping me produce these tapes. And, uh, and I thank you for listening. Stay healthy, stay protected. Thank you again.